So we are week 3 already. I think some of you probably have looked now the announcements. I did put the first exam review there for you. I did it today. It's already posted. I again posted it with the Kahoots and I posted it with your study guide there. So it's in one place. I will take and keep editing it and adding the new reviews in it as I get them. Okay, you don't have to look at 4 different announcements. If you have 3 classes, they all did that, you're talking 15, 16 announcements, and that would drive you just so in this class, as I've told you, I'm not putting a lot of announcements in there. I try to hold it down. I also put in there the brand new dosage calc review I did. It goes up to the point of mics per kilo per minute and shows you how to do it so easy. Okay. And I did send everybody all of the worksheets. Again, anybody who doesn't understand dosage calc, meet with me. There's no reason anybody should get any points off on math. I make it that simple. Okay. And I was told again there was a little glitch on one of the questions. They were combined. Nobody got it wrong, so I didn't have to do any corrections. So if you were thinking, maybe that's the one I got wrong, no, that question, everybody knew what the answer was. So it wasn't a problem. And I did check that. So again, I appreciate when you tell me when something's not right. Yes, McCormack.
I don't know if this is just a glitch on my end, but it's not showing me my quiz one score anymore on my Canvas.
Yeah, because they disappeared, and I have to go back and search it, or I'm gonna have to ask you guys what you did.
Okay.
I was giving I was giving quizzes to some students due to whatever reason, another quiz at another time.
Okay.
And when I did that, somehow the other ones, it completely went away. So there's a way to find it archived. I'll find it. And if not, I know you all did really well on it. That I do remember going back because I had to, give a couple questions back because of those glitches, whatever. So if I have to ask you, that's the reason why. Um,
Okay.
it just happened. I've never done that before. So it's a new
Okay.
one for me, but I'll figure it out somehow.
Okay. Thank you.
So, no, thank you for asking. I was going to go over that, but you helped me guide me into it. So, again, this week are exam reviews. Please, if you can't go, please listen. And I suggest 2 professors. Don't think just mine's going to work. Okay. Go to someone else. Figure out who do you like. Do you like to do it on a Saturday morning? Or do you like listening to who? I mean, you have Sarah Pace Chismar, very enthusiastic, newer professor who loves to teach. She teaches very similar to me, believe it or not. You've got Dr. Arstenstall. She tends to get long-winded. They're longer. And then you have Professor Morris, and she's sort of a dry sort of presentation, but she gives you everything you need. So whoever you like, go to. Of course, always come to me first because I'll give you some good guidance. Right, Alexis? She was there, so she knows. It sounds just like class, but maybe a little bit trying to make sure I drill in the point. I know repetition, hearing things over and over again are going to help you. And that's why I'll just keep saying it and try and maybe explain it slightly different for you. I had a daughter who asked me 100,000 questions my whole life, and she's 39 next month, and she still asks me 100,000 questions a day. And I have learned I had to answer those questions in a way that was simple and understandable enough that she wouldn't ask me, huh? What? What does that mean? Because I didn't have time to say it again because she had another question on top of that. So it's my daughter who prepped me for you and all these questions. And how do I explain things, believe it or not? So anyway, now I've got her son worse than she is, so doesn't shut up. So today, it is week 3. Your goal this week is to study for your exam. You do have a CJ Sims and you do have NCLEX questions. Make sure those NCLEX questions are growth and development. It's not the pediatrics, it's growth and development. And it'll go over it. Now, again, if you don't pick the right one, I'll put a 0. Doesn't mean you're going to get a 0, so take a deep breath. That means I'll put a note that says, please go back and do this instead. Growth and development is going to be on your first exam, and it's going to be really hard and heavy on infants. So I'm just letting you know that because that's who changes the most, right? So that's your insight. This week, school age and adolescence. You're talking ages 6 all the way up to, basically adulthood. A lot of stuff goes on. So let's start with our PowerPoint. Any questions? School age children, school age children, ages 6 to 12. Starts out with their baby teeth falling out, and the end, 6 years later, is when their permanent teeth are all in and puberty starts. So there's a lot that goes on in between there. The growth is gradual, it's step stairs, the same thing. But remember, you start out with a 6-year-old child that is more of that infantile, needs better explanations, all the way up to that 12-year-old who's now almost an adult. So you don't look at a kid who looks like they're old and try to talk to them above their heads. And my example is my little 9-year-old grandson. My 9-year-old grandson is 5'2" and 145 pounds. He's a little, he plays tackle for football, all county tackle for his football team. And he looks like he's older, but mentally, he's definitely a 9-year-old. So always remember that with children. That's the big thing to remember. They grow about 2 inches a year, but in 6 years, it's 1 to 2 feet. They only get 2 to 3 kilos a year in weight, but their weight doubles in this 6 years. Boys or girls are about the same. There's nothing different with it. We know they go from clumsy and more awkward and get more graceful. Their arms, their legs get bigger. Their baby fat disappears. They get more muscles. We know the head and the chest, don't relate to each other anymore like they used to have those big heads. And their faces go from little babies, they're starting to become little adults. And I call it the age of all I want for Christmas is my 2 front teeth. Christian is 7, hasn't lost a tooth except one on the bottom that was banged out, but he's still got his baby teeth. I'm waiting for him to have no tooth. We know their body system matures. One of the body systems we've talked about a little bit more is their GI system, right? We know that their GI, they can't tolerate anything but iron fortified formula or breast milk till about 6 months. And even after 6 months, you're still going to see stuff in their stool. I mean, think about you and think about eating corn. You still have problems digesting that. So babies do too. So it is absolutely normal to see that. If they're gaining weight, they're healthy, cognitively where they need to be, you don't worry. Their heart is more in proportion to their body, and we know their immune system, due to immunizations and getting sick, their immune system is a lot better. Those little soft bones, like the head that we can just mold by just a little bit of tummy time, it's getting harder. So it's going to be more difficult to try to mold stuff like that. Infants are easy, their bones are softer. And as I said, physical maturity is nothing to do with emotional and social. I mean, they may be these big 145-pound kids, and you think that they're mature. He's still a baby. He still needs good guidance, my grandson, okay? One of the things that we see in children is that we have a kid who's starting to he was doing well. And all of a sudden they're getting tummy aches and they're not feeling well. They're getting more injuries that, they've never been injury prone. This is a kid that something's going on, and it could be signs of stress. And a school nurse or teacher be probably the one that would start to see that. So stress could be anything. Sometimes losing a cat to a child could be the biggest stress in the world, or it could be the death of somebody they know, or divorce, or all those things, those big things, but it could be something little too. Now, puberty. Girls are 2 years before boys, that beginning of puberty. Usually girls age 10, boys age 12. Girls start with little breast buds. That's the beginning of the whole thing. Boys get enlarged testicles. And that's what you see. And in this study guide that you'll see, there's the Tanner stages. And it will go over how stage 1 to 5 and what do you see. 1 is baby, 5 is full adult. So the hair grows, they get bigger, enlarged, and all of those things. Now, assessing a child. Now, a school age child is not going to be like the infant. You can talk to them, but remember, how old is the child? You've got to approach the child. You can't be towering over them still because now they feel like you're threatening. So I always sat below them. They're in a bed, they're in a stretcher. I'm sitting in a chair next to them lower. Okay, I'm already not threatening. And then on their level, I'm going to explain things. Now, you think just say, I'm going to go do an x ray. You fell down. We're going to check it out. You don't think that's a big deal. What would a 6-year-old boy who loves superheroes think? Gamma radiation rays are to come out and penetrate my body and hurt me, right? So explain it in a manner that is non-threatening and they understand. I'm going to take a camera, like a picture, like I always do to you, but I can see inside your body and it doesn't hurt. And when you come back, I'm going to show you that picture. I used to always show my children the picture, whether it was a pneumonia or whether it was a broken bone, because when they see it, they understand it more and they'll take care of themselves better. You always inspect, auscultate, percuss, and palpate. It's part of the assessment. Lymph nodes, we know you shouldn't feel these at all if they're well. If they're sick, is when these lymph nodes do come out. Now, in health assessment, you had to do your assessments, right? And one of them is a hypoglossal nerve. You know, children, even infants, you can prod them to stick their tongue out. Do a little 3-month little infant, sit there and stick your tongue out at that child, and you'll see them try to get their tongue out. So you know the hypoglossal nerve does work. And then again, breath sounds. Children have this upper airway and it's full of mucus, okay? And we can hear that bronchial or the upper airway, or we can hear the long breath sounds. So if you're doing it up here, listening to the breath sounds, you know you're listening to that mucus. Kids don't blow their nose, and they always have some sort of secretions in there, right? Not like us adults, we blow our nose, we clear our throats. Children don't do that. Now, psychosocial and Freud. Now, Freud with school age children is same sex peers. They're friends. They're going to be same sex. And this is part of, learning another person, cultures, families, habits, etc. And that's their relationship. Now, Erickson, just like the question, that question 10 on the last exam, Erickson talks about industry versus inferiority. And those words drive me crazy, but let me explain it. Industry is my factory, it's my house, it's what I've made, and it's doing really good. It's all the things I do well. I cook, I play piano, I'm good at math, spelling, cook, whatever. That's my industry. My inferiority is feelings from me or other people telling me you don't do that good. They want to do everything well. Because remember, Erickson and school age children talk about they're pleasers. They love to please. I do all this stuff and I do it well, okay? They want that approval by doing things good. They don't want to not be able to do it because then they don't feel good about me. Now, Piaget, now this is cognitive and this is thinking and it's relating. Now, they're all about concrete, which is what? What you can touch, feel, see, smell is concrete. What they've seen before and understand. And they can understand things by what they already know. They don't know how to figure things out yet. That's your adolescence. Children, school age can't, okay? They are all about understanding putting things in order. All the cars, all the trucks, all the red things, the blue things, the tall things, the short things, they know how to put it in order, okay? Another thing is they'll understand, unlike younger children, if you give a preschooler a nickel and a dime, they're going to say, which one is bigger? Which is worth more? They're going to say the nickel because it's bigger in size, but we know it's the dime. Another thing, we have a glass of milk, a tall glass and a short glass, and they're the same exact. You pour the little glass and the big glass, it's at the same levels. A younger kid is going to pick the tall glass. That's more milk, but it's the same, okay? These now are understanding cognitive, the brain works. It's the understanding. Whether they're put in order, they're all messed up, it's still the same amount of stuff. Now, when this is what we were talking about right here about pouring the tall cup of soda and the shorter one. It's all about the same thing. They also, again, the preschooler and your school age again are understanding more than themselves. They don't, it's not that egocentrical me, mine toddler. So they are going to do things to try to help you. You're not feeling well, or they can see you need help. And that's just part of them doing that. Formal operations, that's in the adolescents. I'll go more into that. That's how they fight their way out of a paper bag and get what they want when they want it because they know how to work you. They understand. Now, Kohlberg. Kohlberg's all about morality. This is about right and wrong. This is punishment and reward. Now, school age children love to please. They like to conform. They like to do what they're supposed to do. They don't want to be punished at all, okay? Spirituality starts with, of course, the family and what they are showing them. So it's concrete. What did I see? What did I learn? Now, if they've gone with one of their friends, their peers, maybe they're in a different religion and know another one and see it, they'll understand it. But they usually just understand what they have seen, okay? And we know school age, just like preschoolers feel, when they get hurt, when they get sick, they feel that they are being punished for for some sort of misbehavior. Okay. And this is something that goes on through the middle of your school age thing. Okay. So, I mean, whether they believe it, seen it, or think it, they know they're being punished for being bad. Peer group, number one, peer. They are the biggest influence, really strong influence in their life. For instance, one kid wants to play softball, baseball. The other kid likes soccer. And if the other one kid is more dominant and demands, I want to play soccer, I'm not going to play baseball, the other kid might come to play with his peer because he wants to be with his peer. Okay. So, really influenced by them. Clubs and peer groups, they're good. Parents still need to be around watching it because in those clubs, in those peer groups, brownies and Girl Scouts and Cub Scouts, etc., you're going to have always that person who's the bully, right? And going to make you feel inferior. Especially, I mean, I was the quiet kid actually growing up, and people tried to bully me, but I had 6 brothers, so I was lucky. My brothers would come after them. They didn't know what they were getting in for. But bullying is happening. It will happen in all levels, in sports and all over the place. So parents really need to be there for them. And remember that parents at school age need to be parents and not their friends. They need to be there to answer questions, especially if they have peers, and learning different values, etc., and making sure they're learning the correct way. Play is always going to be here. We're adults. We play games all the time, right? I have one game I play on my iPhone all the time. Try to keep myself alert, making words up. So, one thing about play is that there's rules and there's things they have to do in order to win. And this is important. It shows them how to conform. It's going to show them how to do a job and get it done later on in life, right? Quiet games and team play, working together, these are all important. And, if they're doing something well, that's all about making them feel good, right? It's all about their industry. Children are aware of what they do good and not. And there are many times there's teachers, there's the one who's in charge of the sports or in charge of the Girl Scouts. It's another adult usually. They are significant and they do make a difference in their children. And the one thing that it could be said with that is that they really need to be positive and they need to at school age, they want to know verbally, wow, that was a great job. They need that because they're trying to do good. They're starting to develop that body. Like they're understanding that, wow, I've got big eyes, or they're blue eyes, or curly hair that everybody loves, or whatever the thing is. They're starting to understand. They're starting to really understand that there's different colors hair, there's blonde, there's brown, there's redheaded. They're understanding that. Fat, skinny, tall, short, hearing aids, glasses, maybe the kid who in a wheelchair in mainstream school because that absolutely can happen. Because they're in a wheelchair doesn't mean they're mentally, cognitively not smart. There's many kids that are. When they go to school, especially not just preschool or any sort of daycare, school is regimented. They have to sit, they have to listen, and they have to do what they've been told. And they can't just get up and run around and do what they want. It's a hard, hard thing to do. It is a place where they start learning about other kids and other mothers and fathers. Okay. They're also learning different values, different religions, different eating habits, everything. And at this time, those peer relationships, again, I can't say it enough about school age, very, very important. Nutrition, nutrition, nutrition. I can't say enough, can I? Nutrition always is the gas that feeds the tank, that keeps the body, the mind moving correctly. And school age children are the best group of children to teach. You teach children in school age about foods and food groups and eating and unhealthy and not smoking and not doing drugs. They're listening and they're learning. Again, remember, they're pleasers, right? So we need to teach them. We don't want them to be that obese child, right? And because they're sitting there playing their games all the time. Fast foods are always a big concern. You know, it takes two people to contribute to a family to keep it running today. So mom and dad are both working. And sometimes it's, oh, let's just run through wherever and get food at the fast food. We need to remember that's not the best choices and that it is high in calories and fat and it can have a child becoming overweight when there are other choices that maybe could have been done. On the internet, My Plate shows children how to put their food groups together and get better food groups. Because we know overweight children are going to have what we call cardiometabolic changes, which means those children who are overweight when they are school age become adults with high blood pressure, diabetes, high cholesterol, and it can be stopped when they're school age. Why are these kids getting bigger and heavier and more obese as children? Well, it's either because they can't go out and play in their neighborhood because it's unsafe, or they prefer to stay home and play on their video games and their Switch and their TV, et cetera, et cetera. And they sit there and munch and they don't move. And you don't move, you gain weight, right? And as I said before, that early education, that school age education, it is going to help prevent obesity. Now, When we talk about obesity, it should start prenatally with the mom. So it should be part of the prenatal um, type of education. Also, what do we do when we're infants? We weigh them every time. Children, every time they go to the doctor, ER, urgent care, you're weighing them and you're seeing how tall they are. So if we're seeing they're getting too big, too small, of course, interventions can be taken for that. It's all ethnic groups, all cultures. It's, across the board. So we do know that children, um, these school age children is a great group to teach. So why wouldn't we? One of the things that was said was school age children at school age that are told they must finish their plate, they become adults that have to finish their plate because of what mom said. They shouldn't be. They should eat what they want. Now, they don't finish their plate, you say no dessert or no whatever, but they shouldn't be forced because then their mind is always, I have to finish it, even if you're full. Sleep. Well, we know that infants sleep a lot and then it gets less as we go down slightly. School age children need about 9 to 11 hours so that they're alert and ready for school the next day. We know young kids are going to fight going to bed. I need another kiss. I need a glass of water. I have to go to the bathroom. I need to give daddy a hug. And it goes over and over and over again. I mean, if there's a routine, sit, read them a book, the quiet time, whatever, that can be done for your younger kids. The older school age kids, they're tired. They're going to bed. They don't care. It's the young kids that do fight with it. As I said, sports clubs, whatever, remember, there are issues with it. Because remember, even though they're that big, brutal, like my grandson, this 145-pound tackle, it doesn't mean mentally he's ready for everything that goes with it, which means, the bullying and the parents in the stands, oh, you should have had that tackle and blah, blah, blah. Parents can be pretty mean too. I live in Miami and my son was in sports and some of the parents, I wanted to, give him a across the head. Like these are kids, let them play. This isn't the end of the world. This isn't like the Super Bowl here. The kids are doing their best and that's what competition should be. Kids love competition. They love to win. But I always said they need to like to lose too, as long as they've done the best they can, right? It's my belief. Dental health, what I told you, all the teeth come out, right? All the baby teeth gone. And now permanent teeth are coming in. So we need to teach these kids how to take care of it. Brushing their teeth at least at night. Flossing them is great too. But younger kids, those first graders, kindergartens, they don't know how to floss properly. Maybe those little stick things, one of these sort of little things could be used, but even them, they don't know how to get it in there properly. So, something parents need to help with. If they're losing teeth, they're not doing proper dental care, they're not brushing, and if we see caries coming in, cavities, periodontal disease, it's all because they're not brushing properly. We know that there is times where they might have to get braces, teeth are not crooked, that's something that happens in school age. What would you do if the whole front tooth, root and all, fell out? And it's usually on a jungle gym. It is in a pool. They come down until their tooth falls out. Permanent tooth in the front. What do? You take it.
Put it in
Don't
milk.
put it in cold milk. Absolutely, Alexis. Good. You take it not by the root, but by the enamel. Put it in there, get to a pediatric ER, or you get to a pediatric dentist. And I've seen many of one put back in and it stays. And that's better than, can you imagine a post and a tooth? How much that cost the parent? If you had to do that, thousands. I'm 5,000. It's a lot of money. Even with, insurance, it's horrible. So teaching parents that's important. Now, sex play, curiosity, this goes on all through, childhood. Preschoolers are playing house together, checking each other out. It's something that you need to just dispel. Say, come on, let's distract, do something else. School age children, that's when they become more verbally curious. They want to know, why is mommy pregnant? How did daddy do that? Well, first of all, you need to know what do that child understand, and you don't have to go into the whole thing, but it's nice to find out what they know, and then very easily let them know. Because sex should not be made into something nasty and dirty. It's a normal part of life, okay? So it's a part where they can talk with mommy and daddy, that special time, and mommy and daddy should. I mean, you always have a school nurse. Those are always great, especially as they're older. So, sex education and school nurses. I remember getting that film on menstruation when I was in school. I'd sign this little permission note and whatnot, and I had no clue what they were talking about. My mother didn't talk to me about nothing, so I was acting like I did know everything, but I didn't. But it's one of those things that they do. And school nurses need, if if they're seeing issues with the children or the child, that they need to contact parents and talk with them, and answering questions. And as they get older, in their adolescence, your school nurse is going to be the one maybe that tells them, talks to them, and maybe gives them information on birth control, whatever, or abstinence. That's when they're older. School health is a great field for many nurses, especially if you want to have kids, because you're off summers and Christmases if you want to be with your own child, right? It does work out well. They do a lot, actually. When COVID hit, let me tell you, they were probably one of the most utilized nurses around. They had to keep that school informed on what was the most up to date CDC, what was happening. And they also use with things like bacterial meningitis. And the hospitals have to inform the schools, and then the schools would send out letters to the other kids. If your kid rides this bus, or your kid's in this school, or if your kid has been da da da, he might have been in contact with bacterial meningitis. He needs to go get prophylactic antibiotics, things like that. Um, and that's school health, following that, and so much more. Injury prevention. Well, what did I say is the biggest injury for all types of kids? Motor vehicles, whether they're in it or ran over by it. And, as I said, I have seen them ran over and nothing happened. And then I've seen the opposite, ran over and they didn't make it. So I've seen it all different ways. Making sure children are in car seats, that they're in the appropriate front or rear facing, those shoulder straps in there, and that it's an adequate car seat that's not expired. Now, as I said early, if you start seeing a kid having more and more injuries they've never had, bad behaviors, again, that could be something going on in the family. Sometimes teachers notice it, sometimes nurses saying, I've seen you here before. What's going on? When you work in an ER, sometimes you see kids coming in and out all the time. And like, what's going on with you? Rear seat, you should be till you're 13 years old. When I got divorced from the children's father, they were 9 and 11, and they would be calling shotgun who was going to sit in the front seat with me. And I didn't know any better because, these things have come out through research that children, they're better in the back seat till 13 and in a booster till they're 8. These all-terrain vehicles, and let me tell you, I live by the Everglades. There are a lot of ATVs out there daily, and they say children under 16, they're not having the smarts enough to go out there alone on their own ATV. They could get lost, things could happen, and they're not prepared for that. So it's not recommended, okay? Bicycles, helmets need to be used or whatever. Yes, Alexis.
I was just curious. So with like ATVs and stuff, does that include like kids that are in those types of sports that you would like recommend against those or
If they're in a sport where they're monitored, they're not going out on their own, that's always monitored. Now, that's a great thing, anything monitored. But what I'm saying is just having a kid who's going to be back there doing what they want when they want it. Not a good thing for that. You can't watch them because once they're out there, they're gone. And in the Everglades, you don't know which way to go. Skates, skateboards, scooters, ATVs, you got to be careful of equipment. I mean, Christian just got a hoverboard and those little sneakers with those roller things underneath. Well, let me tell you, I went out and bought him a helmet, elbows, wrist guards. Those are the biggest things, and knee pads. And he's not going to go out without them on because I have seen bilateral fractured wrists when they first came out with those hoverboards. I know better. And trampolines kids love. They're not recommended for nobody. So, what happens when the kids get school age? When the kids are younger, mom and dad are in control, right? And everything the kids does. As the kid gets older and gets more independent, they are starting to go out on their own. Parents still need to be there and watching because it doesn't mean that their peer friend or where they are is the best of environments. You have to still be a part of it. So you've gone from mom and dad and your family, now you're meeting other people. So other ways of thinking, culture, manners, et cetera, et cetera. One of the big things that can happen, and you can see in school age, is ADHD, attention deficit hyperactivity disorder. This is when a kid is, they call inattentive, hyperactive. What they do is they start tasks, they never finish, they can't sit, they're disrupting the class. And these kids are sent to the nurse usually because it comes to the point where I don't know what to do. I can't keep this kid sitting. I can't teach because the kid's all over the place. It's not the kid's fault. The kid has a condition. It's like having diabetes. There's something we need to do. Now, many times, nurses think that the school nurse brings parents in to discuss the child, what's going on. Many times, nurses think that parents have done nothing. The first thing you need to do is don't even think that. You need to listen to the parent. Listen to the parents, see what they've done, and then together, let's work out a plan of care for this child because it is the best interest for the child and for the classroom. Okay, we know this one already. Where are you going to put a tooth for transport? And yes, it's cold milk. Yes, you knew that already. So, adolescents. Now, hardest group of kids to work with. These kids, remember, I'm an adult. They don't like me, right? I'm like a mom and dad. And you, as a nurse, you're an adult. You're more like a mom and dad. So, how are you going to get these kids to open up to you? It's very hard. I call adolescence a roller coaster ride. You need to hold on to the roller coaster and go up and down with it and just don't let go. And that's exactly what I had to do with my kids because boy, did they put me through it. Anyway, adolescents are somewhere between childhood and adulthood. They start, and at the beginning, there's this pre-adolescent growth spurt that occurs. And then you're getting taller, you're gaining weight, you are becoming more alert, you're more social, you're more mature, and all of a sudden you're starting to look like an adult. You're getting breasts, you're getting hair, your voice is changing, and la 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 la. It is really hard to deal with all that. So there's all the sexual changes that go on. We have the primary, which is all about, having children. And then the secondary, all the things that are going to go on now. It's the hormones start, right? And then the acne starts and all of that, and all those mood swings, voice change, hair growth, breast enlargements, fat deposits. So in girls and boys, what we need to know, what's the first thing that goes on? Well, the girls, we know it's about 10 years old, they say, for girls, and then 12 for boys at the beginning. We know girls will have that little breast bud starting, and boys will have that testicular enlargement. Now, they don't catch up till later on. I think when I was 10, I always thought boys were a little silly. They were immature, but that's because you were at the beginning of puberty. They're not there yet. So usually Beginning of this puberty, which would be the beginning of the breast buds, it's 2 years later menstruation starts in girls. Now, many girls in the very beginning have a very irregular menstrual cycle. Didn't I just say they grow in the very beginning, that pre-adolescent or adolescent growth spurt? They can grow to 20 to 25% of their height in 2 to 3 years. And remember, their bodies are all changing and hormones, and the breasts are going and curves are going, and they're becoming young women and young men. Now, girls and boys should have that 3-dose series HPV vaccine, and that's about by that age. Now, this is Tanners. There's boys and there's girls. And what you need to look at it is this, because you're going to see questions. I saw one on a HESI, and I've seen students come to me and tell me the NCLEX had them. Know that 1 is nothing and 5 is fully formed. So you have 2, 3, and 4 in between that you can say, so what stage would it be? Well, the first stage in girls is breast enlargement, and the first stage in boys is testicular enlargement. And then it goes with hair coming and breast forming, et cetera, et cetera. So take a look at it and see it, because you're going to see it again. Now, I've talked to you about that growth spurt already. It's that 20 to 25% in that 2 to 3 year period. And, obesity, early menarche, is there something with that? We don't know. More girls than boys with it. And voices change in both sexes. As I was a young child, was a high soprano. And then later on in high school, I was in the church choir and I was an alto. I mean, my voice really changed. So boys and girls both change. Erickson, adolescents, who am I? What's my identity? Do I like girls? Do I like boys? Do I like both? Do I like none? What am I going to be when I grow up? Where am I going to go to school? Who are my friends? Are they the band geeks? Are they the sports geeks? Or am I going to be with the art or theater group? All of these things is all part of their being and thinking. Who am I? One of the biggest things that causes the most turmoil is their body image. Too fat, too skinny, too many pimples, my hair's too kinky, too red, too this, too that, my feet are too big, whatever. They are all into body image. And when they don't like their body image, and especially if they're cast out from their groups, these can cause severe, severe depression. And adolescents, one of the biggest risks for death is suicide. If an adolescent comes to you expressing something about depression and just rather die, take it seriously, because it will happen. So always remember that. Our job in children is to protect them, whether from the parent or from themselves, okay? That is our job. Social development. Now, we've gone from needing mom, needing adults to, I don't want you. I want to do what I want, and I don't want any responsibility. And I just want to be liked by my bodies and by my peers and them, my buddies and them, as I call it. And I want to look good. That's all I want. It's just part of that social being in an adolescent. We know they go through problems with understanding there are privileges that are given to adolescents. They expect it just to happen. They don't want to do any responsibility. They don't want to have to, help their brother or their sister, many of them, or take the garbage out or keep their room clean or get good grades or whatever it is that the family focuses on, okay? So they're what we call this major conflict of independence and control. It's ages 15 to 17. That's right after that growth spurt. And that's now they're starting to feel pretty good about themselves. And now they want to just do what they want. What is suggested is, and as nurses, we can tell them, is sit down with the child and figure out what works. This kid might want to go out on Friday night and come in at 1 or 2 in the morning. And that's just not acceptable for a 15, 16-year-old. They're only getting in trouble, right? So maybe if we say, these are your responsibilities. If you do that, you can stay out till midnight. It's something that has to be worked. It doesn't always work. The kids are still going to do what they do, but it's something that, can be worked on. Like I said, it's a roller coaster. Hold on tight. Their peers are more significant than everybody else here because it gives them a feeling of being wanted, needed, and you feel pretty cool when you're with your buddies and them. Okay? Best friends are happening now, not just a peer friend, same sex. I mean, it could be a same sex best friend, not necessarily has to be, but what they do say that how you treat your best friend as an adolescent is how you're going to treat your partner of life. So if you've had a great best friend as high school and you were a best friend back, you're going to have great relationships. Now, how do we as nurses get to talk to these kids? And all we want to do is help, right? That's why we're nurses. So we need to understand something to figure out how we can help them. So what do we do? Well, you're not going to sit down below them and go on their developmental level and talk to them like the young kids. That's not going to work. So what have I done? How have I done it? Well, you see kids come in, they got earbuds in, and they're listening to music. Say, so, hey, what sort of music do you like? I might know who they are, and they'll go, oh, how do you know that? I'm like, well, I've got kids too. Or you might see a sports shirt. Oh, you like the Yankees? Oh, I like the Yankees too. Or, so how's school going? Have you decided college yet? What do you want to be? You try to just be interested in them. Another way is, and these are really the most difficult of all, you might get a female or a male that a female acts more male or a male that acts more female. And that's fine. Now, I had a female client. Her name on the chart was Rachel, but she was dressed very masculine. And I could see her cringe when mom or dad or I'd mentioned the name Rachel. I said, so tell me, what would you like me to call you? Do you have a nickname? And she said, no, my name is Ray. I'm like, okay, so Ray, tell me about da 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 da. Let me tell you, that just opened up the world for me because you've accepted them for them. You've understood that because they're very insecure about it. And it's okay. But that's just society, right? Getting a sexual history is hard. What I do, get the parents out of the room because I'm not talking in front of anybody. With my parents, no way, it wasn't going to happen. But pull me, them out and let me talk. I don't, as a nurse, have to tell the parents what's going on unless it's going to hurt themselves or others. Okay. So if you're asking them about sexual experiences because the girl's in there for the second urinary tract infection, I'm like, so why do you think you're getting that? And so, well, I'm having sex. Or they might say, well, I'm not having sex, but I'm having anal sex. And maybe that's it. I'm telling you, these kids will tell you things to try to blow your mind. Keep a straight face and listen. Give them the opportunity to say whatever they want. And another thing is, if after you talk to them about these things, they're not have enough information, always tell them to go to the school nurse. School nurse always will give them oral information and written. As I said, it's that 3-shot HPV series. And try to teach them about nutrition. Know that, adolescents have a lot of problems with body image. And you're going to see a lot of those eating disorders. So you're seeing weights going up and down and whatnot. That'd be the time where we would say any eating or nutritional concerns, getting a diary from infant to adult can help you guide them into what they need to do for themselves. Adolescents should sleep, but they don't. There's always something else to do. They're either homework or they're talking on the phone till 2 in the morning, playing a game, right? Or they're out at whatever. They should exercise and they should brush their teeth. These are minimal things. We know as sexuality, I told you that where they should get information from the parents if they speak to them. That's usually the last one they go to, but school nurses, and usually school nurses will send them also to Planned Parenthood, and if Planned Parenthood is still there, depending on what's going on in society today. Safety, injury, again, what's number one? Motor vehicles. And now these kids are driving. So now it's getting really scary, right? Of course, there is firearms. They're picking them up. They're big enough to touch these things now, causing problems. They love sports. They're very competitive. They may not warm up the way they should, or they're overdoing it to look good, to get sports scholarships, etc. So injuries are huge, sports injuries. And then, of course, any injury prevention that we can prevent, we could try. Now, man is 14 years old. He's always eating, but his weight is appropriate for his height. Why is that happening? Well, look at the age. What happens in that first beginning of adolescence? That growth spurt, that weight gain, right? So what is he doing? He's eating, because he's growing. Absolutely normal. Apps. Try to keep food in the house. Two kids that are both 14 at the same time. It was horrible to try to keep it because they ate. That growth spurt. Any questions? Susanna, your phone is black. Miss Garcia, just to let you know, your phone is black. I don't see you. Can you hear me? Does anybody know Susanna? Could you text her and let her know?
I can text her.
I appreciate that. Thanks, guys. See, that's being a nurse. That's working with each other. Looks like she just went off probably to come back on. Nursing is watching out for each other all the time. You don't do it alone. You're going to fall on your face. It is a we. It is not an I. So, here we go.
Suzanne takes it back. She says she got kicked out of the Zoom, but
I
she's trying
saw
to get.
that. I saw that. Thank you. Appreciate it. You know, Dr. Brown is, I'll be sending a message to you. She's going to have open office hours every Monday from 3 to 7 p.m. Eastern time. Anybody comments, concerns, need to talk to her, she's going to be available to you. And I think that's awesome. Dr. Brown is very approachable. She's not the big, mean, bad wolf. She's not. I've been working with her now for 4 years, and I'm very happy. Supports you. You do the right thing. She's going to make sure you get what you should have, okay? So, school age adolescents. Now we've gone through all of the stages of children, and now we're going to be tested on it next week. Let's just get her going so we can get out of here about 10 o'clock. I think that'd be awesome. My time, 10. How does the onset of pubertal growth spurt compare in boys and girls? Is there a difference? You know, it's funny that I do remember when I was in 5th grade that I just thought boys were just silly and stupid and immature. And remember, I had 6 boys, brothers at home. And it's girls, it comes 2 years before boys. And I think part of that, you know, hormonal that starts, I think it did make a difference in that thinking. But I still remember way back when. That's scary. A multi. What activities are appropriate for a 6-year-old child? Okay, 6, they're school age. They like to do things and they like to be able to, right? It's their industry. They want to do it well, but they want to be challenged. They don't want to fail. So, which one of these would they be able to do? And that's the way you need to think about that. Their organized sports is over their head at 6. They don't know how to understand that in the competition. And they don't know how to do a game yet, a solitary card game. They don't know how to put the cards out as well. I mean, some can, but it's a little bit too much at this. Ride a bike, jump a rope, play hopscotch. Oh, yes. At what age should a parent expect to have major conflicts over independence and control with their child? That's that 15 to 17. They're over that growth spurt. They're big, they're maturing, they're looking older, and they just want to do what they want. And the parents, they're going to have the fight. That's 15 to 17. Signs of the onset of puberty in girls is and that's the development of the breast buds. Very good. The onset of puberty in boys is characterized by one of these is Tanner stage 2, and then it goes into the full development by stage 5. And that's the testicular enlargement. Yes. What do we use to determine if a female has reached the age of menarche? What would you look at? How would you know? And it's Tanner stages. Tanner's is showing you start to see breast buds, you know something's going on, right? And if the male says, yes, my testicles have gotten bigger, well, that would be the beginning. And if you saw no hair, you know where they are. A child goes to the ER with a little fever, this rash with these open, oozing papules. Nursing care includes. Now, this has happened to me many times where you get these questionable cases, and the problem with this is how do you take care of you and the child? What could this mean? And it's better to be over prepared than not. This could be chicken pox, that oozing papules. And the other thing I've heard is different stages of healing if it's gone on for a while. So, chicken pox, varicella, still can be caught with the vaccine. That's the one thing. So, it is spread through airdrops, through your breathing. So, you first put the N95 mask on. It's the best one to do, and put this child in a room where the air goes outside and it doesn't come back into the environment. You know, especially in an ER, you have immunosuppressed sick kids there that don't need to get chickenpox. The source of injury, whether intentional or unintentional in adolescence, is associated with what? Any injuries, any kid, what is it? Motor vehicles. You know, intentional getting on the hood of the car when they're driving and driving around parking lots to try to push them off. I've seen that. Then they are onto the pavement and scratched and road burn everywhere. I mean, motor vehicles. It's another way they get hurt. If a parent feels uncomfortable talking about sex education, who's a good resource? I mean, if the parent feels uncomfortable or if the child feels uncomfortable talking to the parent, yes, it's the school nurse. A 9-year-old friend tells him soccer's a dumb game and he should play baseball. What's that all about? 9-year-old. So remember, it's all about peers. They want to be friends, same-sex peers, and they please each other. And that acceptance is more important than playing what they want to. And they're not necessarily bullies. During admission, the father of a 16-year-old says, "We're Buddhist. Culturally competent care includes what?" I moved from a very small town in New York. There was no culture there at all. And I moved to Miami and I was in culture shock. And what I've learned is you always ask, so is there anything that I need to be aware about? Is there anything I need to do for you or not do? And you can ask the 16-year-old or you can ask the parents. It could be maybe they're vegetarian, or maybe it's a girl who can't have a male as a caregiver, or maybe they need time for their prayers or religion. These are things, all you do is ask. When you ask, parents feel better about you because you cared. They'll trust you. When teaching sex education and contraceptive for adolescents, what should the nurse consider? So teenagers don't need to talk to their buddies and them. They need good, solid, accurate information. So they need it orally, talk to them, and give it to them in written form so they can see it. Because as you go around playing telephone, whispering something in somebody's ear, when it comes back to you, it's a completely different story, right? You have it written, it's not going to happen. They have it accurate. A multi. The management of adolescent obesity should include what? I mean, this could be school age, this could be adolescent. So what we want to do is whenever there's a problem with food, whether too much, too little, is number one, get that diary. Okay. Find out what they're eating. Always try to incorporate something good in their food. I mean, they like ice cream. Once a week they have an ice cream, right? So I'm going to include nutritious food as a method of reward. Here's a carrot. You've been really good. No, that's not what they want, not nutritious. And diversional activities are more for the younger child, and we use that more diversion when we're distracting them, like when they're in pain. Infants go through a predictable sequence of growth and development. What is that called? Now, you'll always see me put questions in from last week, and I think that helps you understand these concepts better. Predictable sequence. They lift their head. They go from their front to the back to their front. They crawl, they creep, they walk. And it's definitely just sequential trends. Don't let that word say, well, it can't be sequence. That's too easy. Well, that's what it was. Which benchmark serves as the ending period for school age children? So we know the beginning of school age is the loss of their baby teeth, right? It's the onset of puberty, and then all of their teeth are in, their permanent teeth, right? Very good. Which action would improve dental health in school age children? And the one thing about this is remember that young child, a first grader, kindergarten, they don't know how to floss, but flossing, very important. It does improve health for your teeth. Generally, the earliest age at which puberty begins is, when we get to endocrine, we're going to talk about, puberty coming too early, but that's just a different topic. That's not the normal. 10 in girls, 12 in boys. Yes. Girls before boys. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Why is she saying that? They absolutely believe this. As children that are these school age and even preschoolers, many children come in, and one of the biggest things is appendicitis. They come in and they have to go to surgery and they're scared. And the one thing I do to these children when they're my kids, I'll sit down with them and say, listen, your appendix is this little piece of something that your intestines don't like, and it just needs to get rid of it. You have done nothing wrong. It's just something that don't want to work anymore. Then I'll say, they'll do it through your belly button, and I'll tell the doctor, make sure they put an extra stitch and make sure it's really tightly closed so your insides don't fall out. And these kids, you can watch their shoulders relax, and now they're not worried. They go into surgery with a better mindset. Believe it or not, it is really an issue for school age and even your preschool. So a 6-year-old needs a chest x-ray. What explanation is the best? Just a big camera. We're going to look at your insides. Yes, remember, they have these imaginations. We don't want to scare them. How do you get an adolescent to open up about their sexual history? We're going to ask the parents, right? Parents don't know. No, tell me about yourself, something. And then at that point, they'll talk. And most of the time when you want to do this sort of assessment, you have the parents leave the room, right? So how can you get an adolescent to be more receptive to talking about their health and their sexual explorations? And again, parents, get them out. They'll talk to you. And again, I'll tell you, you don't have to tell the parents what they said unless they're going to hurt themselves or others. Because remember, we're protecting children. A multi. When educating adolescents about the risk for HIV and hepatitis, what would you include? I mean, as part of your sexual, education, whatnot, but what's part of that? Well, number one, you should tell them they shouldn't. They should be abstinent, but adolescents going to do what they want. At least tell them about the condoms and always hand washing. And I sure hope they're taking more than just a weekly shower. A child's a knocked out tooth. Where should that tooth be placed for transport? Well, we know that answer. It's in cold milk. Yes, it is. Good. And what they do is they'll numb the area where it came out with this very good numbing cream. And then the dentist comes in and sort of pushes it and wiggles it and gets it in there. And then afterwards, they'll be on a very soft diet. And then they follow the dentist. And I'm telling you, most of the time, it'll reattach. A nurse planning care for a school-age child should know which thought process is seen. School-age children. How do they think cognitively? What do they think? And it's actually the ability to conserve. That's about the glass being short or tall, or big clay that's smushed that's smaller. It's understanding that those things, even they're looking different, they're both the same. That's the thought process they were talking about here. What stage of Erickson would you use for that school age child? And it's industry versus inferiority. Industry, my house, my factory, my building that's producing good and making me money. And then inferiority, I can't do all of this. But these are the things I do well. These things I can't and I feel inferior for. School age children's moral development. So remember, we have preschoolers, which think one way, and school age get a little bit more involved. And then your adolescents just conform to society, right? So when we talk school age, we're talking they like to please, they conform to please. They're doing right and wrong based on consequences is your preschooler. That's what they understand. School agers want to do right all the time. A multi. Anorexia nervosa is characterized by. Now, I got a couple questions on some eating disorders here. I don't have a slide on it. I think I can explain it here. Remember, body image is huge. Anorexia nervosa, they think even at 70 pounds that they're way too much fat on them. Okay? A fear of weight gain. This is where they don't eat anything. They eat a lettuce and a glass of water, then they get on a bicycle and they do 10 miles, because they're over exercising. It's that unrealistic body image. Vomiting and purging, they don't. This is bulimia. Okay? So, how do you know if you suffer from bulimia? There you go. They eat like tremendous amounts of food. And some of them will take, instead of going into the bathroom because the parents know, they'll take garbage bags and fill it up with their vomit and get rid of it so that the parents don't see it. They do all of this sneaky conniving thing. Now, anorexia nervosa, you don't vomit. Bulimia, you do. Bulimia with the vomiting, you're vomiting stomach acid. It will rot the teeth. That's what you'll see difference between the anorexic and the bulimic, okay? The teeth will be bad on a bulimic child, okay? That's the one thing that, you need to remember. Let me look at your teeth. Adolescents are what? Difficult to work with, right? They can fight their way out of a paper bag. It's somewhere between childhood and adulthood, and they're the most confused, troubles, and frustrated kids because they're trying to figure out who are they and what am I going to be, right? And looking for acceptance from their peers. What is an adolescent's heart rate? When we started off, one of the first cahoots, what's an infant's? Well, there are neonates, 140 to 160, right? And then as we get older, it goes down and down and down and down. Adolescents are slightly different. They are slightly lower than the norms because they're usually more active, 55 to 90. If an adolescent at a heart rate of 120, do they have a fever? Are they in pain? Or are they dehydrated? Right? It's a little bit too high. Those are things I'd be looking for. Remember, elevated heart rates are always one of those things. When talking with an adolescent regarding personal health concerns, what's most important? I think they're talking to you. I think that's the biggest deal, right? You need to let them talk. And again, as I said, they're going to tell you some things that your jaw would just fall to the floor. Try not to. Try to do that poker face because sometimes they do it to look at your responses. But your goal there is to give this child, this adolescent, information that they need that keeps them safe. A parent says the infant puts everything in their mouth. Based on Freud's theory, how would you respond to that? Well, Freud says oral, right? It's the oral stage. They explore the world through their mouths. I mean, they explore their world almost the whole way through. I mean, Christian's sitting there, he chews on his t-shirt. If he's sitting there, looking at something TV or even playing a game, it's just all this oral. It's how they explore. It's what they do. A multi. What could be a sign of potential child abuse? So it is a nurse's responsibility if you suspect abuse to report it. And the whole thing is really those inconsistencies between what are the injuries and what they tell you how it was done. Sometimes the kid is scared to death to open their mouth. That's not a normal child. And again, of course, different stories if you get that chance. Parents very concerned about their injuries usually is not child abuse. It's usually they're thinking somebody else might have abused them, okay? So usually these parents, are, "Oh, well, oh, this happened and oh, they did this and that." Very matter of fact. It's not that concerned that you would see. You don't. In addition to injuries, the leading cause of death in adolescents ages 15 to 19 are what? So adolescence is all about body image. It's all about I'm an adult, can do what I want. It's picking up that gun and it's suicide, both of those things. Cancer, no. It's homicide, suicide. In school age conflict of industry versus inferiority, what does industry mean? The biggest tested things is Erickson's school age, infant, and adolescence. Those are the big three ones I've seen all the time. A little bit of Freud's thrown in there and a little bit of Piaget, but Erickson is the one that you're going to need before the HESI to take a peek at because you will get it on the exam. Which age group prefers to be with members of their own sex? Same-sex peers? And that's that school age child. Very good. The kids 3 to 5, they have no, preference at that time. They'll play all together at that preschooler with toys, but they don't really go into one or the other. True or false? Home support is invaluable to the adolescent. Do they need support from their house, from their parents? Absolutely. What if something happens on the outside? Who do they go running home to? They come home to mom and dad, right? And if you don't have mom and dad there, this adolescent has nobody. Again, they're already looking identity. They already feel, these sort of bad feelings, and now they don't have mom and dad. that would be a child who would get depressed and, you'd see other things going on. So absolutely, mom and dad are absolutely needed. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? It's not anorexia nervosa if they have decaying teeth. Decaying teeth is the vomiting of the bulimia, okay? Dry skin, intolerance to cold, constipation, it sounds like hypothyroidism too, but it's all about lack of fuel to the body, and that's why you see that. A 14-year-old is in the ED after a biking accident. How should the nurse interact with that adolescent? I was a primary trauma nurse for years, and I love being the trauma nurse there. And kids all age come in, and let me tell you, you've got 20 people running after you all at once, touching you, cutting things off, starting IVs, doing X-rays, doing EKGs, and it's happening all at once. 14-year-olds, I would stand by them and tell them, okay, a lot's going to go on. This is going to happen. We're going to do this and that. If somebody pinches you, I'm going to let you know. So don't be afraid. We need to do this to make sure that you're okay and that you're not in danger. Okay. Um, Also, if they're asking questions, I'm going to answer all of them. And while doing that, I'm directing, get this, call that, and don't forget that. Could you bring this over here? And you start the IV and you do. And that's just part of that primary trauma nurse role. But it's that patient number one, keeping them calm. Can you imagine they come in, a biking accident, they got a huge laceration and they're bleeding. They're freaking out, screaming and yelling. Heart rate's up, blood pressure's up. What's happening to that blood that's coming out? It's squirting now. So get them calm. That's what you want to do. Cooperative play. What's that? Remember, toddlers is what we call parallel. Associative is preschooler. Cooperative play is your school age children. And what is that all about? Two or more children playing together. There's a goal, whether they build a house or it's a board game and they win the game. Okay. That is cooperative play. What does moral development involve? So remember, anytime you see moral, you see Kohlberg, it's always about right and wrong and consequence. Younger kids feel that way. And then as they get older, it's wanting to please. And then the adolescence is conforming to what society has, the rules that they need to follow. So it's all about right and wrong and doing what they need to do. Developmental milestones are important to observe because, again, it's another question from last week, but very, very important concept. So when we see something that they're not where they should be, we can say, something's going on here. Let's investigate it. It may be an x-ray or a test, etc. But most of the time, it's introducing early intervention, whether speech, physical, occupational therapy. And as I said, children are so resilient and they want to do what you're doing. They love to play, and these groups know how to make children play to get what they want done. So it's clues to getting it done quick and early instead of waiting later on in life, because then it's harder to fix. Lymph nodes in children with normal findings. They're not sick. What would you see? You can't feel them at all. Okay. If they're sick, it's when you start feeling them. Usually we talk about the neck. Remember, they could be in the armpits and in the groin too for many other different things, but you shouldn't feel them no matter what, unless there's something going on. Depriving a child of food, clothing, and shelter is what? It's just called regular old neglect. I mean, physical abuse is where, they have, been hurt, beaten, et cetera, et cetera. But remember, when we see these things, these are things that need to be reported. As a triage nurse, I worked a lot of triage and worked a lot of being the primary trauma nurse. Those are the two things they always put me in. And as a triage nurse, you would suspect instantly. You just had this gut feeling. And to tell the nurse that you're sending the child to, or talking to the physician who's in charge, listen, I think something's off here. And then they themselves will take that patient, go in and check it out. You need to protect the kids because I've seen horrible things. So our job, protect our children. Which of the following immunizations giving in the adolescent stage? And that's your HPV virus. Remember, varicella is a live vaccine. Sometimes in med-surg, they even talk about live vaccines and when not to give them. Remember, it's just not that immunosuppressed person who shouldn't get them. It's also somebody on steroids. Steroids render you immunosuppressed. I've always seen students come to tell me that was a question that they have seen, that it was the steroids, and we forget about that. It does render you there. ADHD likely involves which of the following? What do you see? Inattention, distractibility, impulsivity, and it's that hyperactivity. This becomes a problem when you have a kid in your class and you can't keep them still. And we need to do something to help them. We don't want to put them right on Adderall or one of those medications. We try to do other stuff first. And if that don't work, of course, whatever medication they need. Remember, it is a disease. These kids don't know how to calm down and sit. So it's something that as nurses, we need to understand too. Some kids just don't. And a multi. An adolescent's brought to the ER with a drug overdose. What are the initial questions you need to ask this adolescent? So rehab, that's not even the question now. That's why are you asking me that? We want to know, when did you take it? What was it and how? We know orally it lasts longer than IV, goes away quicker, right? So knowing those things, we'll know how we need to take care of that child. And I've seen, actually, probably I've seen more alcohol abuse than drug abuse, but it is real and it's something that you will see, and that's the questions you need to ask. And last question. Adolescents typically place blank on peer relationships. And we know they're more important than anybody else, aren't they? So let's see who did what today. Number 3, Will. Good job, Will. Number 2, Alexis. Somebody beat you out in the end. Number 1, Sierra. Good job, Sierra. Number 4, Ace and Alicia. So tell me, did that review today help you, Alexis, with this? I'm sure it did, because you got a lot of those questions there that'll help you. So again, remember, this week is all about getting ready for that exam, and know that there are reviews. There's one posted already with a new dosage calc. Anybody who needs one-to-one dosage calc or one-to-one for the exam, let me know. I want everybody to do well. Okay, it's a lot of information. I think I've clearly given it all to you. And if you think and say, what would she say? You're probably correct. So anyway, you all have a great evening. I will see you next week.
Thank
And
you.
again, let me know. There
Thank you.
is a test exam posted. Do it in one of your classes. There are some changes in ExamSoft, okay? In one of your classes, not all. In one class, do the ExamSoft. I've posted yours, okay?
Thank
Okay.
you.
Thank you so much.
You're welcome.